Tucker, the naturopath from New Zealand. Thank you for coming back to my channel. As you're aware, we're expanding on the channel. This channel used to be called the Candida Crusher channel because I have got a big focus on gut health, particularly yeast infections, but also small intestinal dysbiosis or bowel overgrowth, inflammatory bowel disease, irritable bowel syndrome, all of those conditions. But of course, because I've been a clinician, well, retired now for 30 plus years, I've seen many people with many conditions. So the name change for the YouTube channel was basically signifying that we're going to talk about a lot of different stuff, not just only Candida in the gut. Here's a question from a subscriber. Greetings, doctor. I'm an 18-year-old female and I've always had problems with my menstrual cycle. My cycle was very irregular and I would have periods once in 5 months or so. I've done blood hormonal tests before 2 years ago and everything came back normal. I was told I was a bit underweight. I'm 50 kilograms. What's that, about 95 pounds, I think? And I'm 171 centimeters tall. And that could be the cause. The past 4 months, I started to incorporate more fat, healthy fats into my diet, and also started to see cycling and my cycle starting to normalize. But recently, I did a hormone blood test and my progesterone level was extremely low. Other hormones are in normal levels, including thyroid hormones. I also suspect I might have Candida. I'm reading your book right now and it's helping me a lot. Since last year, I've been suffering from gas, bloating, constipation, food intolerances to gluten, dairy and yeast. Seborrheic dermatitis on my face, itchy ears and anxiety. So let me just unwind a few things here. So the anxiety is an interesting one. Where are we? We are anxiety. I try to eat a very healthy diet without sugar, but all of these symptoms sometimes get better and sometimes worse. Last week I saw that I developed athlete's food. I didn't mean athlete's foot. Athlete's food. You can't develop food. You'd be an interesting person if you could develop food inside your tummy. And more recently, what I believe to be dyshydrotic eczema on my hands, according to Google, because I haven't been diagnosed yet. Be careful. I've seen people self-diagnose brain tumors. Seriously. I'm very stressed. Let me underline that one. About the eczema on my hands because it's the first time I'm experiencing something like this and would really appreciate a video on that. My question is there any link between low progesterone and Candida symptoms and what can I do about it? All these things make me very anxious. Well, that's actually the third time anxiety's been brought up in this. And my family thinks I'm over-exaggerating and it's all in my head. When I ask doctors about digestive and skin symptoms, they always say I'm perfectly fine. Also, naturopathy is not very well known in my country and I still can't find a practitioner. I wish I was a naturopath myself so I could cure myself. Sorry for the long email. So, Miss 18-year-old. The first thing I picked up, of course, was the anxiety. And also, an important thing you need to learn is it's not uncommon for females, especially younger females, to have low body fat and not to have menstrual cycle because you need estrogen. You need that body fat, really, that estrogen-sensitive body fat to get the cycle working properly. Over the years, I've seen many athletes as patients. I've seen a few Olympic athletes, and some of these girls don't have periods for a long time. They're so skinny and so low body fat content. It's not healthy to not have a cycle. It is something that needs to happen on a monthly basis. Okay, it's a regular part of who you are. I mean, cyclical hormonal patterns are very important, not just from the progesterone, testosterone, estrogen, the sex hormone perspective, because hormones basically work in massive feedback loops. There are over 170 known hormones currently in the body. There's probably only about 20 really that we talk about a lot in medicine, but there are many other hormones. So how I want you to think of hormones work basically like a Swiss watch works, okay? One dial will turn, it'll click, and it'll cause something else to move, which will cause something else to move, and then the whole thing works beautifully together, okay? One of my doctor friends once told me that taking the oral contraceptive pill is like working on a fine piece of a fine Swiss watch with a pickaxe, okay? So you're taking to something precision and you're going to hammer the crap out of it. So you need to be careful taking medications that affect the cycle, particularly synthetic estrogens. I'm no fan of those at all. So when it comes to the prevention of pregnancy, I think there are other methods that you could be looking at, barrier methods, rather than just hormonal pills, which are often prescribed to treat skin conditions. It's very, very important that you get the right body weight, okay? I'm talking to you now, the 18-year-old, but there are other 18-year-old or 20-year-olds that will be listening to this video, hopefully for a few years to come. So the key thing is, I'm picking up out of this, is that you're anxious, you're scared, you're worried. And generally I find people are worried the most about their skin. They're not worried about their liver, they're not worried about their kidneys, or because you can't see that stuff. You can see this stuff. You can see this stuff, but you can't really see the lungs inside and things like that. So progesterone is a key hormone that actually reduces anxiety. In fact, some of the first drugs ever made for anxiety were modeled on the molecule progesterone. People don't know that. Progesterone soothes, calms, relaxes the body, okay? And it needs to, because when a woman's pregnant, okay, she's got 30, 40, 50,000 times more progesterone in her body than she would have when she's not pregnant. Now, nature has imbibed this to be so. It's made this like this, okay? Because the woman needs to have high progesterone, because progesterone is the love hormone. It makes you feel good. Makes you feel, oh, I'm so sexy. Look at me. I've got this big tummy. I'm gorgeous, you know. The woman can look like a beluga, like a big whale, but she feels gorgeous. You don't see many pregnant women that don't look radiant. Now, radiance, okay, that smile, ear-to-ear smile, that's progesterone, okay? When progesterone drops, you've got problems, big problems in a female. Particularly anxiety will go up. Progesterone also stops pain because, when the baby's being born, everything's stretching and moving around. So progesterone is a wonderful hormone for that. It's a nurturing hormone. Estrogen has different actions on the body than progesterone, but they both work in tandem, and you need a balance of both of those because at different parts of the cycle, one's going to come up and one's going to go down. So cycles work best, like watches, okay, when they're working in unison. It's very rare for me to look at a hormone test and see one hormone that's out of kilter. It's usually several will be out of kilter. And in my opinion, one of the key things that affects hormone is stress. It's how you worry about things. Some of the biggest hormonal issues I've seen were the young women aged between about 18 and 25, boyfriend problems, mum problems, university problems, flatting problems, trying to get out into a flat, sharing a flat with another girl who's using all your towels, leaving wet towels lying all around the place and does your head in, okay? Flatting with another girl who leaves a chicken carcass lying somewhere and it's doing your head in. So, you know what I mean? Things that just annoy you can really affect your hormones, particularly if they go on and on and on. Social media, I think, has a big effect on hormones too, because it makes women think they should look a certain way, and that can cause a huge amount of stress. Many women starve themselves. I've seen so many female patients with eating disorders, with cutting disorders, with hair pulling disorders, with, feeling terrible. I've seen women that weigh, 80 pounds and think they're obese. So you've got a problem when you're 40 kilos and you think you're fat. But then I've also seen other women that weigh 300 pounds and they think they're sexy. Now I like that, okay? Not that they're 300 pounds and they're sexy. I mean, maybe they are sexy, I don't know. Anyway, I'm getting off topic here. But the point I'm making is they've got confidence. They feel good about themselves in their own body, okay? They've got a very positive body self-image. That's very, very, very important at your age to have a positive self-image regarding your body. Don't worry about the skin. We'll come to that in a minute. So if you want to get estrogen and progesterone balanced, and also particularly testosterone, we haven't got time in this video to talk about what all those hormones really do. Testosterone is a super important one for females as much as for males. If you want to get the hormones balanced, the diet has to be good. As you've mentioned, you're eating some healthy fats. Very, very good. I'd like to see you put on a little bit of weight, a little bit more. And once the period starts normalizing, you're going to get a nice cycle each month, okay? And it's working properly. I want you to do a test called, let me write it on the back of this. It's called the Dutch test, okay? DUTCH, dried urine test comprehensive hormones. Dried urine test comprehensive hormones, okay? This is a very, very good test, scientifically validated, okay? You provide a saliva sample, you provide a urine sample. Blood testing for hormones is pretty inaccurate at times. It's difficult, okay, to really get a good understanding of the spread of hormones through blood testing. We know that blood testing for example, adrenal hormones like cortisol is very difficult. The salivary test is far more accurate. Okay, that's been documented now many times. All right. So a saliva test for certain hormones will work, and a urine test. The Dutch test changed how I practiced years ago. I used it on many hundreds of women, the test, and I found, particularly the older ladies my age, going through menopause, I found incredible imbalances. They're usually very, very low estrogen in many women, very low testosterone, so they had no libido, and these things can be remedied, all right? Because we've got herbal formulas that are very effective. I've got a good friend in the States, Dr. Joseph Collins, who's done an incredible amount of work regarding yourhormones.com. Go and check out yourhormones.com. Dr. Collins is amazing, and his wife, they worked for many years and have got a fantastic range of products for imbalanced cycles, for example. So the very stressed part could also be to the low estrogen. So having low progesterone. I commonly see this in women. If the estrogen's a bit too high, imbalanced with low progesterone, there can be bitchiness, nastiness, anger, all sorts of issues going on there. Bloating. Liver needs to be in good shape for hormones to work well too. So eating the wrong fats, drinking alcohol, and doing things that affect liver function, particularly the breakdown of hormones, how the liver has to break them down and excrete them, they can really cause a problem. So many girls who don't eat properly or eat the wrong kind of food end up with skin issues. They end up with carrying too much weight, and it can push you down that road of polycystic ovarian syndrome to oily skin, high testosterone, and problems like that. So eating good food for you, the 18-year-old, is very important. Fresh vegetables, fresh fruits, lean meats, maybe a little bit of flaxseed, linseed oil in your diet would be good. Evening primrose oil, a little bit of that's quite nice for the skin. Because of the gamma-linoleic acid, it helps to reduce inflammation on the skin. So for you, young lady, I would probably recommend some B vitamins, some magnesium, and maybe get a Dutch test completed, the dried urine test. You need, but again here you say, naturopathy is not very well known in my country, so that's going to be a bit of a problem. But maybe you can find a doctor like me in another country that can work with you, although I don't work anymore. But you will find someone like me. There's other people out there like me as well. So the skin problem, you'll find, can very much be hormonal, but it'll be very, very well affected by eating proper, healthy foods, okay? Anti-inflammatory foods. I want you to check on this channel and go and have a look at the diet playlist, the food playlist, the different type of foods you can eat for low inflammation, low inflammatory foods. Check it out. This video otherwise will blow out, for an hour or so. So I think the Dutch test is a good one in this case. I'd certainly do it if you're in my clinic. And I'd look more carefully at your diet and try and take out bad fats, soda drinks, sugars, alcohol, things like that. But particularly, I'd be working with you with stress release, relaxation. Okay, so nice breathing. There'll be different techniques I'd be looking at after I got to know you as a person to find what's the best technique to help this young lady really relax. And you'll find that relaxation on a deep level will make your adrenal glands more powerful. I know your thyroid's working well, but I don't know what your adrenals are like. And if your adrenals start coming up, you'll find you'll really feel better. The sleep will really improve, the outlook will improve, the moods will improve, the hormones will slowly balance, and within a year or so, the cycle should be perfect, okay? Just be careful of the oral contraceptive pill, particularly in cases like this, because it can cause a lot of problems, all right? I hope that was enough information for you. Thanks for tuning in.